Hello friends, I'm Dr. Anish Vaknalli. I'm a third generation homeopath practicing for the past 25 years. We have two centers in Mumbai and we specialize in all chronic conditions, and I'm known to be a specialist in children behavioral and developmental conditions such as autism, ADHD, cerebral palsy, ODD, which is oppositional defiant disorder, etc. Today, let's talk about what the 10 most important early indicators of autism are. These indicators are usually something that you will notice as early as probably 1 to 1.5 years of the child's life. Unfortunately, because of lack of awareness and because you do not know what the early indicators are, these go unnoticed. As a result, the child usually comes to us or any other doctor very late. As a result, it becomes more and more difficult to treat the child. So let's talk about these 10 most important indicators of autism. The first is lack of eye contact. When we say lack of eye contact, it means the child does not look into your eyes when you interact with the child. So this can be actually seen very early in some cases. Like for example, when the mother is feeding the baby, you normally expect the child to look into the eyes of the mother. This can be missing in some cases. Okay, so these are really the early indicators, and you could, if you're a little observant, you'll probably identify this and take some measures. As a child grows older, what happens is, if you forcefully look into the child's eye, the child will suddenly just look in the other direction. He or she may become anxious, and as a result of which, the child will refuse to maintain an eye contact with you. Okay, so the first point is lack of eye contact. Second is lack of interaction and joint attention. When we say joint attention, it means meaningful engagement with you. Okay, so this meaningful engagement usually starts between 4 to 6 months of the child's life. And it for example, when you do any kind of activity with the child should give you attention. He should understand what he or she is doing and should engage with you. So this interaction is usually missing in a child. Okay, the third point is very commonly seen is lack of name response and lack of response to commands. So in this particular scenario, what happens, you keep calling the child. Okay, so normally you do expect the child to know his or her name by around say 8 to 9 months. That's when you'll notice this. So you keep calling the child, but the child will be absolutely indifferent. Okay, the child will be in his own world. He'll keep playing with his own toys, will not even look at you, not even turn, at the most maybe give you a glance. Generally speaking, they do not respond to their name. Okay, nor do they respond to their commands. So this is the third point. Fourth would be lack of social interaction, and the child would avoid mixing with his or her peers or maybe family members in their house, and they'll always be more or less aloof. They'll play with their own toys, stay separate, not, they're kind of very unaware of what's happening around them. As a result, they are very indifferent and very distant, so you cannot connect with them. So they, as a result, they do not socially interact. Social interaction usually happens, or you expect this from the child, between 1 to 2 years of the child's life. Okay, so this is when you should observe this. Fifth point would be lack of pointing. You see, normally a child, when they need something, they will point to that object, right? So at the same time, if you ask the child, like, where is the fan, they should point it, or where is the glass, they should point it. However, this pointing is missing in a child. Okay, they do not point. And similarly, when you point at something, they tend to not look in that direction, and they commonly do not express their needs through pointing. Okay, so remember this lack of pointing, and very commonly seen between 10 to 15 months of their age. Okay, the sixth point is a lot of repetitive behaviors. So repetitive behaviors, for example, would be hand flapping. A child will constantly flap their hands. A lot of times they just kind of crunch their hands like this and make, unusual facial gestures. They could also be a lot of jumping. They could be a lot of repetitive behaviors like constantly tapping on something. Okay. So these repetitive behaviors is a form of coping up mechanism of the child, where the child kind of soothes him or herself and reduces their anxiety. Okay. So repetitive behaviors and hand flapping. This can be seen very early, and you may even notice this right from 1 year or maybe later on, and is an indicator, an early indicator of autism. The sixth point would be lack of speech and communication. When we say lack of speech, what that means is normally between, say, around 15 to 18 months, a child should be able to use at least single words. And these single words are usually around 15 to 20. Okay. So, just single words. Like, for example, it can be glass, it can be light, it can be spoon, it can be a toy, which they know. So these around 15 to 20 words is very common in a child, where they should know these by around, say, at least 15 months to 2 years of their life. Now, this is usually missing, and the child will not say these single words. You may notice that the child tends to speak certain words sometimes. They may pick it up, say, from seeing it on a screen, like if screen time was too much, or you may notice that they're just talking something which is very gibberish, not making any sense. They could have a lot of self-talk. They may stay aloof but constantly say something which may not make any sense. Or sometimes they may just constantly sing a rhyme or say certain words which are in their subconscious mind, because they've heard it somewhere, but absolutely, it may not make any meaning. Okay. The eighth point is a lot of restlessness and running around. Okay. Usually autistic kids are not stable. They do not sit in one place. Majority of them would be constantly aimlessly running around, playing with their toys or jumping, climbing up the window, etc. So they're very unsettled. They do not sit in one place. They do not focus. So a lot of hyperactivity and restlessness. The ninth point would be the child normally expresses their needs, especially, for example, when they pass stool or urine, they tend to kind of at least give you some indication. So late potty training or lack of potty training or toilet training is very common in children. And if you notice this right from the beginning, when the child just passes and does not even give you an indication, it could be a sign of that. So keep that in mind as well. The 10th point is actually a group of symptoms. Okay, these are called sensory processing disorders. These sensory processing disorders are commonly seen in children with autism, and as a result, they are associated with autism. We have five senses. Okay, so for example, your eyesight, that's vision, smell, taste, hearing, and touch. So in SPD or sensory processing disorder, for example, to do with your vision, for example, which is all these things are seen in children with autism. So you should be aware of this. They may avoid bright light. Okay, they may avoid the flash of a camera, for example, or they may avoid certain figures which scroll on TV, or certain cartoons which they may see. So it's a very unusual kind of a sensory sensitivity. So visual issues are very common, and you may notice this or at least be observant about it. Okay. The next is smell. Okay, you will notice that children with SPD to do with smell, they tend to kind of either smell objects, or they may smell their food before eating. Okay, or they may smell things which are very unusual, or they may even have a sometimes they may have hyposensitivity, where they may not realize something is smelling bad and they may just eat it. Okay, so this kind of abnormalities in smell is also seen. Taste is very common and is the biggest problem in children with autism, simply because they are very fussy. Okay, it's very difficult to make them eat everything. They may be very fussy, like they may avoid anything that's slimy, for example, fruits, for example, or they may not chew their food. A lot of times they don't let you brush their teeth. Okay, so these are oral sensitivities which are commonly seen. The next is to do with hearing, where they could be sensitive to certain sounds, like for example, it could be the sound of a washing machine or a vacuum cleaner, or it could be the pressure cooker or things like that. So certain wavelengths of sound, they could get bothered, and commonly seen as well. And the last one is to do with touch, where they could be hypo or hypersensitive to touch. And you will notice that they do not like certain textures. And for example, they may keep playing with your hair. It's another sensory issue to do with touch. They may touch your elbow. So it's very, you'll find a lot of variations in children with sensory issues, but these are all commonly seen. As a result, you should be aware of them. Okay. What we specialize is in homeopathy, and we are able to do a lot of changes in autistic kids with all these kinds of symptoms. So eye contact, hyperactivity, sensory issues, all these things usually are the first things that we target, and we're able to help these kids. And we would definitely recommend that you start homeopathy as soon as possible. The earlier you diagnose, or at least if you see these early indicators, at least visit somebody like a developmental pediatrician, and somebody like us who specializes in it, and get a diagnosis first and take appropriate measures. Okay. So I hope you know you're able to identify it early, and I hope you take steps as early as possible. Okay. I'm Dr. Anish Vaknalli. Thank you, and all the best.